Happy birthday to you.
My sister died because of COVID, and she didn't have the virus. So nobody's counting her.
Stephanie Deer's 47-year-old sister Lori is not included in the hundreds of thousands killed by the coronavirus. But Stephanie insists she should be.
This is still hard because I miss her terribly.
Lori Terry was a healthy, active wife and mother. In October, her heart suddenly stopped. The specialized hospital beds in Utah that Lori needed to survive had all been taken, many by COVID patients. It took them 3.5 hours to get Lori the kind of care she needed, but doctors say it didn't come soon enough.
She had a medical emergency that anyone can have, but because she could not access medical care, she died.
Experts call this a nationwide crisis. With the pandemic now pushing many hospitals to the brink, more are being forced to choose between caring for COVID patients and those with other serious health conditions. Nearly 5 million surgeries have been delayed because of COVID. In the next decade, it's estimated the pandemic will cause an additional 10,000 cancer patients to die due to delays in care.
I was just devastated, and I burst into tears.
Outside Seattle in March, Christine Rayburn was diagnosed with stage 3 breast cancer. But just days before her scheduled lumpectomy, doctors called to say it had been canceled due to COVID.
When that phone call happened, I kind of went through the dread and the what ifs and okay, do I start preparing for death? How do I take care of the family?
With the help of her state representatives, Christine pushed the hospital to perform the surgery. Months later, she's in remission. To avoid these nightmare scenarios, hospitals are now scrambling resources. But one review found more than 100 hospitals recently have postponed or canceled surgeries due to the virus. At University of Utah Health, they're having to delay or cancel up to 10 surgeries a day.
And what does that mean for your patients?
It means not receiving the care that they typically would receive in timely fashion. It means living with pain, and that's a big deal.
This will be Stephanie Deer's first Christmas without her sister. She's pleading with everyone to take COVID seriously so hospitals aren't overwhelmed and patients like Lori get the care they need before it's too late.
If one less sick person had been in the hospital that day, she would be here right now.
Oh my God, that's such a sad story. And this is, Erin, this is about doctors and hospitals canceling surgeries, not people opting not to go. So what can people do if they're in that situation?
Yeah, Hoda, well, doctors say there are steps you can take right now to protect yourself. First, figure out how to connect to your doctor, whether by telehealth or online, so you can access care quickly. Second, if you have any new ailments, any dizziness, any pain, any lightheadedness, see your doctor sooner rather than later before it gets serious. And then finally, take extra good care of yourself. A lot of times during the holidays, we let our diets go, we don't exercise as much, but that can lead to serious health problems.
Yeah. Okay, Erin, thank you. For a lot of those folks, though, none of those tips would have actually worked. I mean, they were doing everything right.
I think the whole point is that why are we wearing masks? Why are we doing these things? We got to keep these hospitals so they for other types of ailments.
Our healthcare system, and it's breaking.
Yeah, it is. It is. All right.